Hello, everyone, and thank you for joining us. My name is Faith Din, and I am the Program Coordinator within the Office of Professional Programs. I want to welcome you to the UMBC HIT Fall 2020 Open House. Before we begin, I'd like to just go over a couple housekeeping items. Please note that this session will be recorded for quality assurance purposes. In order to provide the best experience for you and all other attendees, please keep your microphone muted throughout the session, as well as keeping your video off. If any questions arise during the presentation, feel free to utilize the WebEx chat feature to submit those questions. That can be found in the bottom right-hand corner of the module here. We have outlined a question and answer period at the end of the presentation to address those questions. In the event that we aren't able to address your question now, either myself or Dr. Van Dyke will touch base with you directly via email. We hope you enjoy the presentation, and without further ado, I'd like to introduce our Graduate Program Director, Dr. Erin Van Dyke, and I'm going to go ahead and turn things over.
Fantastic. Thank you so much, Faith. Well, first of all, hello, good morning, and I welcome to you all. I'm happy to be able to talk to you all about our program today. Let me go ahead and get my slides posted for you so that I can share this. Wonderful. So as Faith said, I'm going to go through and provide a little bit of information to you about the program, just to kind of give you a sense of what we are, what we have to be able to offer to you. And then at the end, we will have a Q&A session and provide you some information as well about how you can get in touch with both Faith and myself if you have any questions beyond this session as well. So in terms of our agenda today, I'm going to be talking a little bit about UMBC in general, the university. I'm going to be talking a little bit about our faculty and myself, just to be able to give you some context about our professional background and just to provide a little bit of a window about what kind of experience that might be able to provide you as well, so that you can see how our experience in the industry can provide some insight as well into your experience as students. We'll be talking about health IT in general, and specifically why consider a program in health IT at UMBC, the health IT NPS program specifically at UMBC, and then finally, of course, how to go through the application process. So we here at UMBC, we very much enjoy our community. It's something that whether you're speaking with faculty, staff, students, I've personally found it's been consistent that people very much enjoy being a part of this community. But it's also great to be able to see that that this community is recognized as well, even beyond just for many of the great accomplishments that have been achieved both by faculty, staff, and students as well. What we obviously were a #1 up-and-coming university over the course of 6 years, specifically by making the most promising and innovative changes in areas of academics, faculty, and student life. UMBC is ranked 4th on a newly created list of the U.S.'s most innovative national universities, and is also one of the most diverse universities in the United States. And one of the things that I feel is especially one of the things that I greatly appreciate about our university as well is that it's well recognized, and deservingly so, for its research programs and excellent teaching. And I'm going to be speaking a little bit about how, even for a professional program, how I feel that can enhance the education and learning that students in a professional program can take on. So just to provide a little bit of context about my background. So again, my name is Erin Van Dyke. And so with my background, I've worked in the health IT industry for the last about 10 years. I previously as an assistant director for evaluation and assessment, as well as a research scientist. I worked at Johns Hopkins Hospital and Health System right here in the state of Maryland. My primary areas of research up to this point have been evaluating the usability of health IT And specifically, I'm especially interested in trying to understand what are some of the facilitators and barriers in being able to help clinicians adopt health IT into clinical practice. And trying to understand as well, what are some of the competencies that clinicians need to be able to help be able to help improve that adoption and to be able to make it to where we can improve the integration of these technologies at the bedside. As part of my background in my career, I've coordinated and studied the implementation of 2 electronic health record systems within a hospital-wide implementation. And it was through that experience that I was actually able to be able to see, wow, you integrate these technologies into the clinical setting, but it really is so much more than just implementing a technology. You are taking it into the context of this new environment. You are impacting patient care. You're asking doctors, nurses, clinical technicians, clerks, surgical assistants, and you're asking them to change their workflows, either having to change the way they talk about medicine, the way they talk about their different procedures. And so what can we as scientists, as technicians, as professionals be able to do to adjust the way that we work to help them be able to do this so that they can continue to practice safe patient care? As part of my work, I also led assessment and evaluation specifically in leadership development for the Department of Nursing at Johns Hopkins. And as GPD for the program, what I hope to bring to this program as well is experience and oversight of management of educational and clinical programs, as well as part of my role, I also do advising and mentoring of students. With that as well, of course, being able to evaluate programs and curriculum, performance and learning. And then I also do have a background in mixed methods and qualitative research. And as we do have some students who, even as professionals, do like to be able to apply research and data into their practice, being able to use that data to inform some of their professional work, being able to assist students in that. I feel our program is especially lucky to be able to benefit from the incredible work of some amazing faculty as well. We have faculty who work with from a variety of different industries here in the Baltimore, Washington area, and they come from different sectors as well within the health IT realm, and from everything from the NSF to the Department of Health and Human Services. From the Baltimore Veterans Affairs Hospital, Maryland Department of Health and the Hilltop Institute. And it's from this that they're able to pull from their vast experience and be able to apply this to the lessons that they teach into our courses. And as they work with our students, being able to bring their wealth of experience and be able to apply that into the lessons, be able to provide some really great real world experiences, and be able to answer students' questions and kind of help them figure out, well, if I encounter this in the workplace, or if I currently encounter this in the workplace, how might you as an instructor or as a mentor apply this based upon the situations that you've encountered? And from the feedback that I've heard from students, it really has been just a tremendous gift for them. And so I mentioned the fact that we've been lucky to have faculty who have this industry experience because, being a professional program, I feel it's very important that we do have somewhat of a finger on the pulse of what the current industry priorities are. And in healthcare, this seems especially important when you consider the fact that healthcare is such a rapid change environment. It's something where it's constantly changing as the technologies change, as our understandings of disease and conditions change. And so with that, being able to have a sense of what these shifts are is extremely important. And so as part of our discussion today, I basically wanted to bring to you what some of our understanding is of what some of the current industry priorities are at this time, and just to kind of share what are some of the things that we're aware of, and that we know that some of our students are currently working on different projects and issues associated with these timely issues as well. Obviously, COVID-19 clearly is a very timely issue, and this brings about a myriad of issues ranging from real-time analytics, tools to be able to support self-examination, letting people know whether they should reach out for support from their physicians, and then also issues having to deal with clinician burnout, recognizing that clinicians are having to obviously put in a lot of longer hours. They're having to address a lot more patient cases. And how can technology be able to limit the amount of additional workload they're having to put on from a technology standpoint, and maybe even be able to support them in that? There's a variety of different patient safety measures and initiatives that clinicians and various different staff are having to pay attention to. So what can we do to be able to align health IT with that? Telemedicine has, of course, been a hot topic for some time. But of course, with COVID-19, clearly telemedicine has now become a norm for many. And just as a way to be able to ensure that we can maintain consistent contact with our physicians. And so with that, how can we continue to expand this and continue to optimize this? Obviously, with big data, we're having to look at opportunities to be able to increase storage capacity, how to be able to leverage opportunities such as cloud computing. Protecting sensitive data, for example, from cyber attacks. And as we're looking at clinicians and having to be able to manage various different multiple applications, we're having to consider what can we do again to be able to support clinicians in managing this? Because in addition to having to manage their regular clinical loads, we're having to ask them again, well, and on top of this, can you learn these new applications? Can you be able to take on the cognitive load of being able to apply these different technologies into your into your practice? So what can we do to be able to make this more intuitive? And then finally, the application of artificial intelligence, which more and more we're seeing this used in areas such as decision support in a variety of areas. And one area that seems to be especially prevalent right now is in how to be able to address areas such as health disparities. So in terms of who might want to go to a Health IT MPS, well, ultimately it's a program that I think can benefit a very wide range of different individuals. Whether your background is that you yourself are a clinician, whether that be a dentist, nurse, physician, a physician's assistant, surgical assistant. Perhaps your background might be as an implementer or customizer or an educator in a health electronic record. IT professionals, we've had students who are developers, software engineers, researchers, biologists, chemists, psychologists. We've had social workers, systems analysts, perhaps, who want to subspecialize in the area of healthcare. We also have people who specialize specifically, who have backgrounds as leaders, managers, and executives. Perhaps those who are interested in healthcare administration, who are really wanting to be able to have a more robust understanding of the health IT operations environment. Those with a background in procurement and contracts, health policy professionals, those who are aspiring health IT entrepreneurs, and ultimately anyone who is a passionate and dedicated visionary who really just wants to be able to be part of this ongoing future and commitment to improving human health. And if you're looking to a future that has opportunities for jobs, health IT really is a fantastic area to be looking at. As we look at the data from the Bureau of Labor Statistics, employment for health informatics and information just continues to be projected to grow much faster than your average occupation. And in which case, this is a fantastic area and realm to be growing with. There's different types of health IT jobs, and obviously to be able to span in which case you can be looking at health IT systems development and maintenance, in which case there's various different settings to consider, Clearly, there's hospitals, but there's also ambulatory care. There's home care and hospice. There's consumer health IT, such as being able to allow patients to access and manage their health information. There's management and legal consulting, in which case you can go through via public health agencies, legal firms, insurance sectors, and then, of course, legal, state, and federal governments, and a wide variety of other areas as well. So then the question about why health IT at UMBC specifically? Well, personally, I feel that UMBC is really uniquely positioned to be able to provide excellent education in this area. One of the reasons is because UMBC has an excellent reputation in IT education. We're well known for our computer sciences, electrical engineering, and also our information systems programs. We have a proximity to large medical centers and schools, obviously Johns Hopkins Hospital, University, the University of Maryland Medical Center here, and as well as the Baltimore and DC, Virginia medical centers. And in addition to that, as many of our faculty are associated with, we have proximity to government agencies, such as the Maryland Department of Health, National Institute of Health, and Centers for Medicare and Medicaid Services. And another thing that we've had students who often say they appreciate is that our program is flexible and it's sensitive to working professionals, which can be especially helpful in being able to maintain a healthy work-life balance. For example, offering evening, weekend, and hybrid course options. Oftentimes, students want to know a little bit about what the student experience is like here. Now, clearly, as I've spoken to, we have courses that are taught by current practitioners so we're able to draw on that current experience and be able to provide more of an interdisciplinary education, being able to be taught by individuals who are recognized in their field, and furthermore, people who kind of can draw from those different experiences, even if you yourself perhaps are more specialized in one particular area, is very important, of course, seeing as health IT is such a multidisciplinary field. Having flexible schedules, which of course is very important when you're working with group projects, and being able to have the option of having hybrid and online courses. We've had historically small class sizes, so averaging about 12 students, which has been great to be able to help with individual career counseling and mentoring as well. And furthermore, because our program is associated with other entities here within the university, students are encouraged to be able to participate in the university's health IT research, external internships, and be able to attend guest lectures that occur within the department as well. The mission of the MPS Health IT degree at UMBC is empowering professionals to leverage information technology to improve healthcare. And I think you'll see that when you see any of the projects or any of the final products that come out of our program as well. You can see that any of the individual projects that come from here, it really does come back to that core mission of ultimately attempting to be able to improve healthcare and improve things for patients. We want to be able to extend the existing health IT and healthcare experience of students, as well provide a successful career in health IT that relies on deep understanding of various aspects of healthcare. And this means providing a very comprehensive view of that as well, focusing on technology, but also the full context around that as well, looking at people, organizations, and also the environment as well. And this means taking on an interdisciplinary approach with curricula that encompasses healthcare, the actual information technology itself, and also what some sometimes refer to as soft skill development. And that goes back to the management skills. This goes to the people skills, all things that are necessary when you're working with any kind of an organization. And again, once again, you can also have on-campus, hybrid, and online courses available to be able to provide that flexibility. A little bit more detail about the program itself, about the degree. So in terms of the core courses, we have 6 required courses that equal a total of 18 credits. That's going to be Health Informatics 1 and 2, Health IT Law and Ethics, Health IT Policy and Administration, Health Data and Analytics, and your capstone project. These 6 required courses are going to establish kind of that foundational knowledge that we want every student who graduates with this degree to have. In addition, you'll have 4 elective courses for a total of 12 credits that you can take. You have the option of receiving a maximum of 2 courses from other departments, but within our program, the electives that you can choose from are Public Health Informatics, Process and Quality Improvement with Health IT, Introduction to Healthcare Databases, Health IT Privacy and Security, Project Management Fundamentals, Database Program Development, SAS for the Social Sciences, and then, of course, as I mentioned, other graduate courses, up to a maximum of 2 courses from other departments, so long as that you discuss those with me, and then I'm able to approve those. In addition to our MPS, we also have an accelerated BA to MPS program. So with this, an undergraduate degree in the information systems, computer engineering, health administration, and public policy, or a degree related to healthcare professional practice or healthcare management is recommended. Students are encouraged to apply during their junior year. And you can take up to 3 graduate courses that can be taken to count dually for both the undergraduate and your graduate degrees. Now, when you go through this process, a statement of purpose is necessary, and a minimum undergraduate GPA of 3.0 on a 4.0 scale. If you're an international student, then there needs to be an appropriate visa and a TOEFL, and as well as a TOEFL if applicable. A few things to keep in mind as well, a few important policies and designations. When we speak about enrollment classifications, you'll sometimes see in terms, we'll talk about a full-time student and a part-time student. So a full-time student is designated as having 9 credits, whereas part-time is 1 to 8 credits. There's an expectation of continuous registration, so being enrolled every semester in the academic year, which is considered fall and spring. We don't count winter and summer in that case. Now, for leave of absence, that is allowed if you speak with me and I'm able to provide approval. In terms of academic standards, being able to maintain a minimum cumulative GPA of 3.0 during course of study is also expected. There is the possibility of transferring credits. So UMBC's graduate school will allow a maximum of 6 graduate credits, which is the equivalent of 2 courses of transfer credits. This can be done with the consent of the program director and is accepted only if there is an equivalency of programs. Finally, we want to be able to provide you with some information, of course, on how to be able to apply. To apply to the UMBC Graduate School, you're going to want to complete and submit the application online at this address, which we will provide in the chat box. You're going to want to submit an official college transcript to the graduate school. There's going to be an application fee of $50 for online application and $70 for a paper application. There is the option of providing a letter of recommendation, which can be helpful, especially if there's anything that you want to be able to explain, or perhaps maybe a lower GPA, perhaps. But it is important to know, however, that this is not required. For the accelerated BA MPS program application, please know that there is a separate link that, again, we will be providing to you. I thank you very much for being here. I look forward to the opportunity to answer any questions you have, and I invite you to please reach out to me directly if you have any questions afterwards as well. My email here is at the very top if you have any academic and career questions, and as well as Faith's information, as well if you have any administrative questions.
Okay, folks, and just as a reminder, we have the chat box open in the bottom right-hand corner. If you want to shoot your questions in there, we're going to hang out. And I just want to remind everyone that you may have a question that you feel is very specific to your case, but you might be surprised that other folks have the same sort of questions. So don't be shy. Feel free to to ask whatever you're interested in. Okay, I see one question in the chat. Would a bachelor's in emergency health services suffice in order to pursue the accelerated option? I'm going to touch briefly on the accelerated program and the requirements. I'm going to turn things over to Dr. Van Dyke to talk a little bit more about some of the overlaps or potential overlaps between the EHS program and our program in health IT. So just as sort of a heads up in terms of benchmarks, folks that our UMBC students are able to pursue what we call our accelerated program, which allows them to take up to 3 graduate level courses while they are undergraduate students. And those credits will count towards the undergraduate program with prior approval from your undergraduate degree advisor or program director, and then can be transferred into the terminal, the full master's program, if accepted later on. There, of course, is a separate application process for the accelerated program from the full master's program. Some of the benefits of the program are not only reducing the completion time for the master's degree program. Again, if you're taking the maximum of 3 courses during the undergraduate studies, that just leaves 7 courses for postgraduate or post-baccalaureate studies. And then, tied with that is a reduced cost for the master's degree program because you're taking less courses as a graduate level student. The amount of time is reduced, and so the fees associated with that program are reduced as well. And I'm going to turn things over to Dr. Van Dyke to talk a little bit more about the potential overlaps with the EHS program and the health IT program.
Hi, Faith. I apologize. Actually, I apologize. I had a little bit of a connectivity issue there for just one moment. Could I ask you just to repeat that last part in terms of in terms of which part I'm speaking to?
Absolutely. So we had a question about the accelerated program in health IT, and we have a potential student that's interested in pursuing that. And it sounds like they have a background in emergency health services, which is a program that we offer at UMBC. So just kind of talking about some of the potential overlaps and whether that program would be a good feeder into our health IT program, something that they want to consider pursuing in terms of this accelerated option.
Absolutely. And certainly actually in terms of emergency health services, especially, there's a wide variety of health IT related to, of course, emergency health services, as I'm sure you're likely aware, in terms of the various different innovations that we're doing to be able to help support the services there. So I imagine you would see a great deal of overlap related to the course of study that you've done up to this point. So I feel it would be a fantastic bridge based upon the education that you've had.
Thank you. And we have another question. Is there a graduate of our program who has transitioned in the pharmaceutical industry? So one thing to note about our MPS program in health IT, which is, of course, an applied program, is that we have a considerable amount of students that are actually already working in the field. So they're industry professionals. They have full-time jobs and they're completing the master's program part-time, either taking 1 to 2 courses a semester. Of course, we do have traditional students that are coming directly from their undergraduate studies that are pursuing the program on a full-time basis, which again is the 3 courses per semester. So the career data that we're getting from our graduates is based off of survey results. And as if anyone is aware, sometimes we get survey attrition, we get survey fatigue. But I think, in order to answer your question, it may be helpful for Dr. Van Dyke to pivot and kind of talk about some of the benefits of a degree in health IT and how that can help someone that's working in the pharmaceutical industry or looking to sort of break through into that realm.
Absolutely. Well, and certainly, as you're speaking to pharmaceutical, this is an issue that I think is coming up more and more in our program, and something that I think we again keep about going back to the point of keeping a finger on the pulse is certainly on our radar. And one part of my background, having worked with the Department of Nursing, I used to be part of the nursing pharmacy committee as well. And so with that, with nursing informatics, is we recognize that one of the integrations that we needed to include in our health record is how can we ensure that is kind of as part of the EMR, the electronic medical record. Are we able to do a proper medication requisition? Are we able to ensure that the orders are accurate? How can we be able to include our pharmaceutical stakeholders and colleagues into these conversations as well? And so I think that this is going to be an important conversation moving forward, and one that I think we're going to want to, have more involvement in this in our program moving forward as well. So, somewhat of a long, windy answer to say that, I think that by having an educational background in health IT, because it is so multidisciplinary and it is something that touches on each of these different roles and disciplines. And it is something, pharmaceutical is one that we are absolutely very aware of. It's one that you would be able to apply this to your particular discipline, to your particular area, and take with you into your career.
Okay, and we'll give it a couple more minutes for folks that may have other questions. Again, feel free to utilize the chat feature and we can go ahead and field those for you. All right, and as we wrap up here, I just wanted to make one final comment, and then I'll turn things over to Dr. Van Dyke to see if she has any final remarks. But one of the things I wanted to highlight is something that's a little bit lesser known about the advantages of pursuing a graduate degree or being enrolled as a graduate student at UMBC is the number of resources that we have that connect not only to industry, but opportunities for professional development. We have a graduate student association which offers a lot of benefits to graduate students and is sort of part of that sort of auxiliary and additional fees portion of the tuition. They have a student writing advisor on staff that's able to help folks, not with the content necessarily, but with more of the grammatical and sort of idea formation. They have a number of events and workshops for professional development. And then they do have a small sort of pot to offer for grants of a variety of nature. So that's something that is of benefit for folks that are enrolled in the program to take advantage of. That's already covered again in the cost of the tuition and fees. And as a great opportunity to engage with fellow peers in the UMBC community at the graduate level across a variety of programs. So I just wanted to kind of mention that. And again, I'm going to turn things over to Dr. Van Dyke to see if she has any final remarks before we wrap up.
Thank you, Faith. Yes, and actually, just one thing I would love to be able to mention as well, just before we conclude for the day, is just real quick, being able to as well touch on what is one of our foundational courses as well, and that of course is our capstone. This is something where oftentimes we'll have students who will even begin discussing this early on, simply because it's something that is intriguing to them, either because they are already thinking about it as part of their career path, their job that they're already actively working on, or as part of a job career path that they're actively pursuing. And something that I'd like to be able to provide to students, just to kind of give you a sense of kind of what the span is, or what some of your peers as well, because thinking about these are some of the people who you would be working with as well within our student population. Just to kind of give you a sense, some recent capstones that have been available the students have been working on have been there's been one where it's been on the qualitative analysis of challenges affecting children with autism and intellectual disabilities in COVID's syndromatic surveillance. There's been issues involving telemedicine, specifically in Ethiopia, looking at both the prospects and challenges. Understanding the scope of healthcare technology as it relates to addressing mental health concerns in developing countries. Being able to do early detection of type 2 diabetes in adolescents and youths, and being able to prevent complications in early adulthood. And even looking at machine learning, and specifically what steps can you use in terms of social media, such as Instagram, to being able to help further their goal of improving users' mental health. And one of the comments that I thought was really especially insightful, this was actually taken from one of our long-term instructors, one who's been teaching our capstones and some of our other courses as well, And one point that he made was that, that he feels is really something that really kind of differentiates our program from similar programs, that is that it really feels that students here have an opportunity to take on not just the health-related technology challenges, but they can take what they learn here and they can apply the health IT topics to a wide range of subjects, whether it's health, whether it's public health, whether it's behavioral, social policy, justice challenges, legal, whether it's dental, whether it's pharmaceutical, whether it's health emergency, whatever your particular domain is. Again, because we are a very wide multidisciplinary field, you're able to apply this in the area that is your particular passion, and you're able to use that in areas that are new challenges and new opportunities that are facing both this country and in countries all around the world. And I think that's something that is, that I think that our program can be very proud of.
Okay, and again, we'd like to thank everyone for attending this session. The fee waiver code, which is available to waive off the $50 online application fee, is all caps DPS 2021. We look forward to seeing applications from a number of you. And again, welcome this conversation to continue after the session concludes. Our contact information again was on the last slide, and I will drop that in the chat too. Thank you again, everyone, for coming. And after I drop this information, we will conclude.
Thank you all so much for coming.